When you watch a truly skilled dental team at work, it's something else. It's less like a procedure and more like a perfectly choreographed dance. So today, let's dive into this incredible display of teamwork, this silent conversation that we call four-handed dentistry.
So that's the big question, isn't it? How do they pull off this fluid, almost psychic connection, where instruments just appear exactly when they're needed and the work area stays perfectly clear? Well, the answer is a system, a philosophy, really, that turns two people into one incredibly efficient unit. So here's what we're going to cover. We'll start with the core idea behind this dance. Then, we'll break down the specific jobs of the assistant's hands, get into the nitty-gritty of instrument transfer, figure out how to keep the operating field clear, and wrap up with the gold standard of isolation, the rubber dam.
Okay, let's kick things off with the big idea. What is the actual goal of this whole four-handed approach?
And it's art. It's a philosophy built on anticipation and communication, without saying a word. Every single movement is planned to cut down on wasted motion, reduce stress for the dentist and the assistant, and, this is the most important part, make the entire experience so much smoother and more comfortable for the patient. It's all about working smarter, not harder.
So how does this actually work in practice? Well, let's look at the assistant, because their two hands are really the key to the whole system. And what's fascinating is that each hand has its own distinct but complementary set of jobs.
And this division of labor is just brilliant. The assistant's left hand is basically the delivery hand. It's retracting tissues, swapping instruments, and running the air-water syringe. Meanwhile, the right hand, which we often call the pickup hand, is free for more specialized stuff, like handing over materials or pulling off that super important hidden syringe transfer. This setup means hands aren't crossing over each other, and it just creates this perfectly seamless workflow.
Which brings us to the core skill, the absolute heart of the dance, the instrument transfer. When this is done perfectly, the dentist literally never has to look up or away from the patient's mouth. It's just flow. Now, there are a few different ways to do this, but we're going to focus on the techniques that really show off the precision and patient-focused nature of this work. And we'll start with the one that deals with what might be a patient's biggest fear.
Wow, just let that sink in. This really drives home why technique is so important. We're not just talking about mechanics here, we're talking about psychology. This very common fear is something we can address directly with a specific transfer method designed completely around the patient's comfort.
The whole point here is to be sneaky, in a good way. The key is discretion. The assistant gets the syringe ready, totally out of sight, and then uses a very carefully planned transfer, usually below the patient's chin or behind their head, to pass it to the dentist. A lot of the time, the patient never even sees the needle. That can make a huge difference in their anxiety levels.
All right, now for the most common exchange, the one-handed transfer. You can see it's a multi-step process, but the goal is for it to feel like one single fluid motion. The assistant anticipates what's needed, gets the instrument pointing the right way, and then, here's the magic, uses their pickup fingers to grab the old instrument at the same time they deliver the new one. When you get it right, it's practically instantaneous.
Of course, getting this move perfect means you have to avoid a few common mistakes. The first one is crowding. Basically, getting into the operator's personal space before they're ready for the next instrument. The fix is simple. Just respect that ready zone and wait for the signal. Then there's something called shorting the operator. This happens when you hand over the instrument too close to the working end so they can't get a good grip. You got to remember to always give them enough handle to grab onto securely.
Next up, tangling. This almost always happens for one reason. The handles aren't parallel during the exchange. If you just line them up first, the transfer will be clean and smooth every single time.
And finally, disorientation. Handing over an instrument that's facing the wrong way forces the operator to stop, flip it around, and completely breaks the flow. This all comes down to anticipation, knowing where they're working and presenting the instrument so it's ready for immediate use.
Okay, so you've got the instrument transfer down pat. It's flawless. But what's the point if the dentist can't see what they're doing? That brings us to the other critical skill set, controlling the operating field.
And this is why it is so important. The mouth is, well, a wet place. Without constant control over that moisture, visibility just drops to zero. But it's more than that. Modern dental materials are incredibly sensitive to moisture. One little bit of contamination can cause a whole restoration to fail. So this isn't just about being neat, it's about clinical success.
So to get that control, the team has a whole arsenal of tools.
We're talking everything from simple cotton rolls and high-powered suction all the way up to the most complete method of all, the rubber dam.
Now, the two main workhorses for suction are the saliva ejector and the high-volume suction. The saliva ejector is just for low volumes of fluids, kind of managing the background saliva. But the high-volume evacuator, that's the powerhouse. It's held by the assistant, and it removes all the water spray, debris, and fluid. Plus, its tip is strong enough to also be used as a retractor for the tongue or cheek. It does double duty.
And that leads us to our final topic, the ultimate barrier against moisture and contamination. For a lot of procedures today, this is really considered the standard of care.
I mean, just look at this list. The advantages of using a rubber dam are just undeniable. You get a perfectly dry, perfectly clean field, which is absolutely critical for things like composite restorations. It automatically holds the tongue and cheeks out of the way, giving you amazing access and visibility. It protects the patient from swallowing anything. It protects the team from bacteria. It is a win across the board for quality and for safety.
But, nothing's perfect, right? It's not without its trade-offs. It can take a little time to place correctly. Some patients do find it uncomfortable, and it's just not going to work in every situation, like if you have really crowded teeth. It's an incredibly powerful tool, but you have to use careful judgment.
Which really brings us full circle, back to our core idea. We've talked about all these advanced materials and incredible techniques, but every single one of them depends on that seamless human interaction. So it kind of leaves us with a final thought to chew on. Beyond all the fancy technology and all the instruments, could it be that perfect, synchronized teamwork is the single most important tool in any dental practice?